afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy, as always, to be joined by Mayor Ed Holder and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackey. Welcome to the media who are in attendance this afternoon, and just a quick reminder, if you have not already done so, if you have a question to ask this afternoon, just click on the text bubble with the question mark here on Microsoft Teams. And if you could indicate your name as well as your media outlet and who your question is for. Finally, a welcome to all those tuning in this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel. Listeners on Global News Radio, 980 CFPL, and those who are watching on the CTV London website. Let's get to the opening remarks right away, and we'll start with Mayor Ed Holder.
Well, thanks, Dan. Good afternoon, everyone. On behalf of City Council and all Londoners, I'd like to express my deepest and profound condolences to the family and friends of loved ones of the London police officer who passed away yesterday. As Chief Williams has already indicated, further information will be released if and as appropriate, subject to the wishes of the family. This loss of life is absolutely heartbreaking, and our hearts sincerely go out to the officer's family, Chief Williams, his team, and everyone at the London Police Association. So from the London City Council and city staff, our deepest condolences. And where COVID is concerned, today marks another significant step in efforts to stomp out the third wave and ultimately to break the back of the virus once and for all. As we know, about an hour from now, the Premier is expected to release details about Ontario's reopening program and plans. This comes on the heels of London Middlesex having vaccinated more than 50% of all adults with at least one dose, and extremely high demand for appointments being booked by those 18 and over. We're at a place now where, for the first time in a long time, I think there's reason for optimism that a return to the types of activities and gatherings we've previously taken for granted may not be far away. Earlier today, in anticipation of a gradual reopening of our economy, I was joined by the Chamber of Commerce, Tech Alliance, and senior levels of government in officially rolling out London's Stay Safe Rapid Antigen Testing Program. These tests are now available free of charge to any small or medium-sized business in London by visiting staysafelondon.ca. Now, these kits allow businesses to conduct fast, painless, and reliable testing on asymptomatic employees to reduce the risk of community spread while also increasing consumer confidence. So again, that website, staysafelondon.ca. At the same time, I'm looking forward to joining the health unit tomorrow as we officially unveil our latest mass vaccination clinic to members of the media at Nichols Arena. That clinic will begin administering vaccines next week. And once again, I'd like to thank the City of London staff involved with setting up and helping to operate this space. Your efforts, along with those of staff of the health unit, are absolutely vital and will go a long way towards ending the pandemic. And I say this with confidence once and for all. As I said earlier, there's plenty of reason for optimism. It's okay to acknowledge that. And it's important to realize that we're slowly but surely getting to where we all want to be. At the same time, we've got a long weekend coming up. The potential for spread still remains, and the potential for regression is still very real. That's when we need to continue making responsible choices that protect you, protect your family, and all vulnerable members of our community. So I'm looking forward to the Premier's remarks this afternoon with great anticipation, but regardless of what he says, please, in the meantime, wear a mask, physically distance, wash your hands, don't have friends over, and get the shot. So with that, I'll turn it over to you, Dr. Mackey. Thanks.
Thank you very much, Mr. Mayor. As always, appreciate your perspective and wisdom on these issues. The most important thing I want to talk about today is the May long weekend, as you've mentioned as well, Mr. Mayor. This is the weekend where we could blow it all. We want to have a wonderful summer. We want to put this pandemic wave to bed. If we take risks this weekend, it jeopardizes all of that. It jeopardizes any announcements of opening that the Premier might make this afternoon, as well as the health of our family, friends, and loved ones. So for this weekend, yes, get outside, enjoy the great outdoors. Please do not gather indoors at all. Please do not travel outside of your region. Those are the messages for May. Get outside, don't gather indoors. don't travel outside of your region. I want to talk about a couple of other things before we go to questions. First, we're experimenting with an innovative pop-up mobile clinic approach with partners in Thames Centre. It's happening at the Flight Exec Centre in Dorchester. That will be happening next week, but the bookings for that opened today. They opened first through an announcement via local partners, and the bookings for that Flight Exec Centre clinic next week are now open on covidvaccinelm.ca for anyone to book. We have about 400 appointments each day for 2 days on the 28th and 29th of May, and very much looking forward to meeting with people out in Thames Centre to get vaccinated. This will be a sort of a pilot approach as we shift focus from mass clinics over the next few months to an outreach-based approach. The mass clinics have been the workhorse of the vaccine campaign and will continue to be so for many weeks, but we will have to go to next stages in terms of adding other strategies as well. This is an example. We test this out and it's successful. We certainly will look to plan other pop-up mobile clinics in other communities and community locations around London and Middlesex. Last thing I want to mention before we go to questions is the opioid crisis. There was a major report released recently by the Ontario Drug Research Policy Network. What it found was that in 2020, 2,426 people died in Ontario due to opioid poisoning. That's a 60% increase from 2019, a major jump. To give you perspective, the number of COVID deaths over that time was about 4,600. That means that, opioids killed less people than COVID, but it certainly is on par. And in any other times, we'd have no hesitation calling what's happening with opioids a pandemic. There are a few reasons that the ODPRN has identified for the increased drug deaths last year. One is the inherent volatility of the unregulated drug supply. You simply don't know what you're getting when you're buying off the street. Second, many programs and supports for people who use substances have had to, be adjusted in many ways, some even closed because of the pandemic. Third, isolation has become a major problem for everyone. And when one of the harm reduction messages around using opioids is to make sure that you never use alone, because you want to have someone there with naloxone who can call 911 if you do overdose. Obviously, in the setting where we're encouraging everybody to isolate as much as possible for COVID, it makes it very difficult to use opioids safely. The other issue is, of course, the mental health impacts that have come with the pandemic, that have impacted people who use substances just as they have for all of us. Increased anxiety, all sorts of issues where people are looking to self-medicate and often using in a way that can cause other harms. We very much look forward to getting back into that work more intensely with partners. So grateful for partners like Regional HIV/AIDS Connection, London Energy Community Health Centre, and so many others who have been able to continue their work supporting people who use drugs in spite of the pandemic. But I felt it was very important to mark the passing of those 2,400 people last past year, as it truly is another tragedy within this pandemic. Thanks, Dan. Back to you.
Thank you very much, Dr. Mackey, and thank you, Mayor Holder, for your opening remarks this afternoon. We do have a lot of questions already lined up, so let's get to those right away. The first question this afternoon comes to us from Carrie Mackey at CBC London. Dr. Mackey, obviously this is ahead of today's update from the Premier, but what are your thoughts on in-person learning for students? Should they be allowed to return to school, as some doctors are suggesting?
So in-person learning is crucial for the mental health of students and families. I do believe there will be a time when in-person learning will be appropriate and as safe and as reasonable as possible. I think that will happen before the end of the school year. Of course, that depends on how things develop, and it is a decision that will likely be made at the cabinet level by the provincial government.
Thank you very much, Dr. Mackey. Kerry has a couple of follow-ups here. Dr. Mackey, do you have any updates on the AstraZeneca vaccine? Will it be offered as a second dose? And if so, could the shot become available sooner than the expected 16 weeks after dose 1?
Yeah, appreciate the question, Kerry. We've heard the same rumors that you have. There have been rumors of leaked information that AstraZeneca will be available. The manufacturer's recommendation at this point is that the AstraZeneca second dose be given between 2 and 3 months. And I certainly don't think you would see second doses of AstraZeneca before that. I would suspect we come in around the 3rd month. But again, the government has not made a public announcement around the final decisions around AstraZeneca.
And another question from Kerry. Dr. Mackey, what are your thoughts on splash pads? Given the hot weather we're experiencing, will they be treated like playgrounds?
Yeah, appreciate that, Kerry. There's certainly a potential impact on gathering with splash pads that I think would probably be commensurate with playgrounds on an average day. When we start to hit those high temperatures, you could see potentially additional gathering happening at those splash pads beyond a safe level. So, I think there will be a time that is appropriate to open splash pads, absolutely, this summer. I don't think we're there today. The potential for gathering just means that there'll need to be some additional scrutiny and support to run those facilities safely.
Now some questions. We've got a few here from Jane Sims at the London Free Press. Dr. Mackey, was the 90-year-old woman from a long-term care home whose death was reported today vaccinated? If not, why not? And have any of the recent deaths involved people who were partially or fully vaccinated?
Hi. So, Jane, on the question of the most recent death, as we did not, so that individual was not vaccinated. I'm just double checking with our spreadsheet about which individual that was linked to. But I know the most recent death that came through our data was not vaccinated. Why people aren't vaccinated, we don't always get that information at the individual level, particularly when in the past we can't look into that. But again, people who have been in long-term care retirement homes have been offered. There's a catch-up campaign where we're supplying vaccine directly to long-term care retirement homes. If the homes haven't received the vaccine, they should apply. They all have the information. Their home administrators have the information to apply to receive that vaccine. And we're talking about Moderna, so it's a fridge-stable vaccine at this point. So shouldn't be any issues there as we catch up the new admissions to long-term care retirement homes.
Thank you, Dr. Mackey. Jane has another follow-up. Have there been any reports of blood clots in Middlesex-London among people who were vaccinated with an AstraZeneca dose?
Yeah, so we have not had any cases of the very rare blood clots associated with AstraZeneca, Jane.
And last question, Dr. Mackey. Yes, Dr. Mackey, the science table reported today in their modeling that school reopenings will lead to 6 to 11% more daily cases, but that the risk was, quote, manageable. Given that statement, do you stand by your position that schools are safe and there is little to no transmission there?
Yeah, absolutely. So one of the things that has become clear is that the school closures have an impact on COVID transmission that isn't entirely attributable to spread in schools. What we see with school closures is a number of related behaviors, with families spending more time at home, and people generally taking the pandemic more seriously. And so school closures and openings can impact COVID numbers overall, but it's not necessarily related to spread in schools. We're very confident in the statement that we've had that there have been minimal spread in schools. We've never said that there's been no transmission there, but there have been a very small number of cases in this region during the fall term as well as the winter term of transmission in schools. And again, there is risk of transmission in home and non-school settings. If a family is able to supervise their children safely, ensure that they stay home and not gathering with other children, and able to keep them separated, then as a home environment may be safer for that particular family. There are many families where people have had to share childcare accommodations, where people haven't been able to keep their children from interacting with others. We're talking about weeks and weeks of isolation at this point, and of course children want to spend time with peers, whether it's in the neighborhood or friends from school. So in those situations where children are gathering outside of school, it means that the transmission could be happening outside of school at a similar rate or even potentially higher rate for some of those families than they would be facing in school. So, the decision to open schools or close schools is not a decision made in a vacuum. It's not a pure decision that you're going to reduce the number of contacts and increase the safety of children. There are trade-offs, and of course, the mental health and well-being is a trade-off as well. You may have seen advocates identifying code pink that has been, linked with the severe impacts of school closures on mental health of children and others. And so all of those issues have to be considered when making the decision about opening or closing schools.
Thank you very much, Dr. Mackey. Let's go to our next question. It comes from Jennifer Beeman at the Middlesex-London Health Unit. My goodness, this is what's happening now. Jennifer Beeman at the London Free Press. Her career is still at the paper. Yes. Dr. Mackey, Jennifer asks, how many vaccine doses is the London area expecting next week?
So we are receiving on the order of 25,000 Pfizer doses per week at this point. We don't have an exact number for Moderna. The allocation seems to be in the range of 10,000 every 2 weeks, but that is not certain. It often changes week to week when the delivery will happen, and we don't have forecasting for beyond the next week or so.
Thank you very much, Dr. Mackey. Another question from Jennifer Beeman, who works at the London Free Press, by the way. Dr. Mackey, some regions are already administering doses to youth between the ages of 12 and 17. When will this group become eligible to receive vaccination in Middlesex-London?
The Premier announced last week that children 12 to 17 would become eligible on May 31st, and we're planning to align with that timeline. We're working closely with the school boards and with Southwestern Public Health, for whom the school boards overlap, to make sure we've got a good plan in place to hit the ground running when that happens, including designated spots in school, in our mass clinics for children and families. Looking forward to announcing all of that. We are finalizing the details of the plan, anticipate being able to announce that at some point next week. If the province decides that across the province, we're going to open bookings to people aged 12 to 17 earlier than the 31st, as the Premier indicated, then we'll do our best to meet that timeline as well.
Next question from Jennifer Beeman. Dr. Mackey, other than the 3,000 or so appointments that are released daily, will the health unit be able to release additional appointments in the coming days?
Yeah, at this point, Jennifer, we haven't had any indications of increased supply, so we will not be able to release additional appointments for the 3,000 or so that you're indicating. We saw a great drawdown of the 30,000 appointments or so that we were able to make sure we're in the system Tuesday night. The 24,000 we initially had are all gone now. There's kind of a residual 6,000 or 7,000 with many bookings happening each day and additional appointments, as you say, coming into the system. Because of the announcement for children and families, we've had to put some of those additional appointments later in June on hold, but we look forward to opening them up soon for those families. Right now, there are spots available in our mass clinics if people need to book their vaccine, covidvaccinelm.ca.
Dr. Mackey, the next question comes from Andrew Graham at Global News Radio 980 CFPL. Dr. Mackey, this morning you tweeted a call out for innovative ideas to help get more people vaccinated. Any ideas so far caught your attention?
Yeah, thanks for asking, Andrew. So essentially, we're entering over the next 4 to 6 weeks. We'll enter a phase in the campaign where we shift from the high volume, efficiency oriented clinics, and we are doing more of that outreach and work to try and bring in people that either have some level of vaccine hesitancy or live lives that make it very difficult to make time for a clinic, whether it's because they have families or other reasons, and make sure that we can bring as many additional people on board as possible. And so traditional approaches to that would include things like advertising, would include things like the outreach-based approach where we're actually going out into the field, working with community leaders to get the message out. We're doing all of that. We also, welcome input from those that have other perspectives, might represent or be connected with a community with a lot of hesitancy or accessibility issues for the vaccination campaign. And the message that I sent out earlier today was to try and bring those new ideas out of the woodwork. I haven't had a chance to review them all. Looked a few minutes after sending the message out, and there are already half a dozen things that have come forward. One of that I think is definitely worth mentioning here is connecting with faith leaders. I know the mayor and our staff person, Steve Turner, have connected with faith leaders in London. We want to make sure that dialogue is open and ongoing. We also are looking to connect in a stronger way with faith leaders in the county of Middlesex as well, to make sure that they have all of the relevant information and to ask for their support for the vaccine campaign. There are, lots more ideas flowing in from that we'll be looking through over the next few weeks.
And a follow-up question from Andrew Graham. Dr. Mackey, can you discuss what's being planned already by the health unit?
Yeah, I think I did mention that, Dan, around advertising, outreach, clinics, pop-ups, that sort of thing. Yeah.
Thank you. All right, let's go to the next question. Okay, this may be something that I don't know if you have this information, but I'll ask the question, and it's from Andrew Graham again at Global News Radio. Dr. Mackey, what percentage of adults currently have appointments booked for a local vaccination?
Appreciate that question. So we did have that great announcement on Tuesday from the Ministry of Health that over 50% of the adults in London and Middlesex have received a first dose of vaccine. That's huge momentum. It's something we definitely are celebrating at the Middlesex-London Health Unit. I know many of our partners are as well. We have about 20% of the adults that are booked to receive vaccines within the next 4 weeks or so. And we, of course, are seeing bookings coming in every day. And we hope to get that up over that time frame in the next 4 to 6 weeks, up to 75% or so, and then keep trucking from there.
Another question from Andrew Graham. Dr. Mackey, do you want to see select outdoor activities such as golf or tennis opened ahead of this coming long weekend?
I appreciate the question, Andrew. This is really a provincial decision. I do sit on the public health measures table that advises government on that. I'm not able to talk about what advice the government has received. You are talking about relatively low risk activities. The risk is really around the activities that often accompany them. Are people going to change rooms together to get ready for their tennis? Are they, in the locker room getting ready for golf? Are they going for a beer together on a back porch afterwards? These things that accompany those activities can make them higher risk. So it's, again, not a simple calculation around one part of the picture. I definitely think that there will be a time that is appropriate to open those soon, given how low risk they are. We need to have that communication around the related activities and how those can reintroduce the risk that those otherwise, healthy, low-risk activities can pose.
Thank you very much. Andrew did have a final question, Dr. Mackey, for both you and Mayor Holder. Is there any advice that you would want to share with folks ahead of the coming long weekend? Mr. Mayor?
Why don't I start with that? I think there's been a consistent message, actually, that we probably emphasized for about a year and 3 months, Dr. Mackey, I think. And you say it never gets tired, but you certainly hope that when the student is ready, the teacher appears. And in this case, what have we said consistently? Wear a mask, physically distance, wash your hands, don't have friends over, get the shot. It's as simple as it gets, and it's as critically important as it gets. If that needs to be repeated louder, I will. But I think that's the point that Dr. Mackey and I have made consistently.
Thank you, Mr. Mayor. And I think, Dr. Mackey, you've spoken to this already during this afternoon's briefing. So let's move to the next question. And this is something we were talking about off the top today from Wendy Spence at the Dorchester Signpost. Dr. Mackey, with regards to the mobile vaccination clinic at the Flight Exec Center, which vaccine will be administered? Where exactly in the Flight Exec Center is the clinic being held? Is it on the North Ice Pad, the South Ice Pad, the auditorium, or the gym? Is there going to be a wait list in case some people don't show up for their appointments, or perhaps if they're symptomatic on the day of their appointment?
Yeah, so thanks very much for the questions, Dorothy. So mobile vaccination clinic at the Flight Exec Center will be administering the Moderna vaccine. It's a bit more stable for transport and refrigeration purposes. Where exactly in the flight center? So we will be using the auditorium for that facility. Is there going to be a wait list in case some people don't show up for their appointments? You know, we really haven't seen that in our mass clinics. We book them at around 100%, and it's 99% of people who show up for their appointments. So it's something that we can manage from the very small number of people who don't come, and we have processes in place to make sure that there are no doses of vaccine that get wasted. I think that's most. Oh, say, is there going to be a wait list? Right, if people show up and they're symptomatic on the day, yeah, for sure. People are screened through the registration process for symptoms, but then also on the day when they arrive. And that can result in some people not getting their shot. It's a pretty small number, and we're able to manage that so we don't waste vaccine. So Wendy, I think that's all your questions. If you have further that I haven't hit there, please to send them along. Oh, one other thing I did want to circle back to, Wendy, I mentioned in the intro 400 doses per day. That was a mistake. It's 200 doses per day. The total is 400 for those 2 days, 28th, 29th of May next week.
Thank you very much, Dr. Mackey. Another question come in from Jennifer Beeman at the Free Press. Dr. Mackey, how worried are you about a May 24th weekend spike? Do you consider community spread currently to be high in the London area?
You know, the May 24 weekend is the biggest risk we see on the immediate horizon right now. If there's a lot of family gatherings or, you know, gathering with friends around the May 24 weekend, that's going to put our recovery and our wave 3 progress at risk. So it is something we're watching closely. We very much hope that people consider the risks and do not gather indoors during the May 24 weekend.
Next question is from Jane Sims, and Jane was asking for a little clarification. Dr. Mackey, have any deaths in Middlesex-London involved people who have been partially or fully vaccinated?
Yeah, so thanks for the question, Jane. We spoke about this on Monday, I believe, but I'm happy to go over some of the work that we've done again. So what we looked at is deaths since in the last month and a bit, since April 1st. And in that time, as of this past Monday, we had 2 deaths in people who had been fully vaccinated. That's in the population of people over 80 who, that population is in the tens of thousands of people. That rate of death is much lower than it would be expected to be and has been measured here to be in the unvaccinated population. People that are unvaccinated in London and Middlesex that are over 80 are dying at roughly, our data is small, so there's a wide range, but 3 to 12 times more frequently than people who are fully vaccinated. Again, there have been a couple of people who have received a vaccine but not yet achieved immunity, who I'm not sure where you would count them in our stats. I do not consider them to be protected by the vaccine. So if somebody's been vaccinated and they pass within 2 weeks of that vaccine due to COVID, we know that the immunity doesn't kick in to the 14th day. So we would consider those folks to be unvaccinated from the point of view of calculating the risks. And we've had 2 or 3 of those over that 1 month time period as well, Jane.
Next question is from Matthew Trevithick. Dr. Mackey, what was the response like on Tuesday when vaccine eligibility opened to all adults over the age of 18? How quickly were spots taken? How many hits did the booking portal see?
Yeah, great question, Matthew. We were seeing about 4,000 hits a minute at the peak when we first were opening, kind of in the half hour before and after 8 o'clock. We had a wait time on the website. There's a wait time function to avoid people being just automatically given an error message. So the wait time was at one point about 56 minutes. That was the max that we saw, and it came down very quickly after that. We had I mentioned 24,000 appointments available Tuesday afternoon. Those disappeared within the first 2 days. We had opened another 8,000 appointments up, essentially taking a bet on our longer term vaccine supply. And most of those got booked within the 3 days of opening to that 18 to 39 crowd. And we still do have, as of right now, about 5,000 appointments left in the system. We've had, more appointments coming in as we add those appointments that are a month out. And so we've skated through. We've, great demand. Obviously, tens of thousands of people booking for vaccines is great. We want to work with that 18 to 39 population to make sure we pick up more of those individuals. Traditionally, especially with things like annual flu shots, it is a harder population in terms of uptake. We've seen great uptake here. We want to get those numbers up as well. I want to be clear, there were many of that population who had also booked already because of the eligibility as healthcare workers or as people who are in essential frontline work who can't work from home, or because of their own healthcare conditions. So the total number of people in that age group that have booked will likely receive an update sometime in the next couple of weeks from the ministry stats. That is the only way that we really know for sure about that population. But again, happy to see good early uptake. We want to keep moving through that population to get more and more people vaccinated.
Thanks, Dr. Mackey. And a final question from Jennifer Beeman. Dr. Mackey, Ontario received 2.2 million doses this week. We're 3% of the population. 3% of the doses is 66,000. Are we getting shortchanged on supply?
So, Jennifer, I don't exactly know how the accounting is happening with those 2.2 million doses. I know that the ministry is committed to a population-based allocation. And I don't know whether that means we will be getting more in future weeks. Well, one thing that we do know is that about 9,000 of those will be going through pharmacies. So that's an allocation that we don't have complete visibility for. So, and then other than that, we don't know where the rest of that 66,000 would be allocated.
Thank you very much, Dr. Mackey, and thank you, Mayor Holder. That does bring us to the end of our questions for this afternoon's briefing. A couple of announcements to the members of the media on the call. Further to the media advisory you received about tomorrow at the Earl Nichols Recreation Center. If you could get back with your responses to us by the end of today, that would be great. And also a reminder that our next virtual media briefing will be happening not Monday, because Monday is Victoria Day, but on Tuesday, the 25th of May at 2 p.m. So between now and then, We do hope you enjoy the weekend and the nice weather, but remember to maintain the guidance that public health has put out for so long. Do keep your physical distance, wear a mask if physical distancing can't be maintained, and limit your interactions to those who are in your household. Thank you. Have a great rest of the day, and so long for now.
You're listening to Stingray Music.